Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
What's your assessment about pregnant women being moved up the line? Is that something that the United States can and local authorities can turn around that quickly?
Well, I mean, yeah, you could just make a declaration. That pregnant women, all should get the vaccine. Very simple. However, remember, this is under an emergency use authorization. No pregnant women were included in those studies. So they aren't, all the data we have in pregnant women is basically anecdotal. Now, plenty of pregnant women have gotten COVID and plenty of pregnant women have gotten the vaccine. And theoretically, it should be okay. Pfizer has just launched a study in pregnant women, 4,000 women worldwide. So we'll get an answer in 2023. I don't think pregnant women want to wait that long.
Oh, all right. So let's talk about the safest states during the pandemic: Alaska, Hawaii, Maine, North Dakota, and Wyoming. Is that just based on people being more spread out in some of those states, or are they doing things better than we're doing?
Robin, I think you just answered your own question. Look at those states. Those are the least populated states in the United States, and not exactly, but close. They're all. Hawaii has probably more than any of the other ones. But in Hawaii, I mean, nobody ever actually has to ever be indoors almost. I mean, the weather is like perfect year round. And so that's really what's driving these numbers, is that you have states, a lot of land, not too many people, they're spread out. So there's, it's just not congested. And, some of them have very good health policies. Hawaii and Maine in particular have very good public health and have done a remarkable job in tracking patients and testing and treating.
All right, let's get to some viewer questions. Here's the first one. I work at an essential business in Alsip, and our employees are eligible to receive the COVID vaccine. But some employees are Indiana residents. Since Indiana has not yet opened their eligibility to essential workers, would they be able to receive the vaccine in Illinois?
Well, I'm not actually a public health official in Illinois, but my gut feeling is that they should, because if they're going to have a problem in the workplace, it's going to be here in Illinois. So I think they should. The Illinois, both the state of Illinois and the city of Chicago have been very open with who gets the vaccine. They want the vaccine out there. They're not making these little micromanaging decisions like many states are. But so I think that person would have good luck getting the vaccine in the state. But you'd have to ask the officials.
All right. Next question. My extended family wants to plan a cruise for October. Would you go on a cruise ship?
This brings up this timing is really critical. Because if we have all 600 million doses that we need in this country by the end of June, or end of July, that should give a couple months where anybody that wants a vaccine will get it. I think what's going to happen, especially on a cruise ship, but there are plenty of other circumstances that are like it, is that you're going to start seeing a vaccine-only approach. In other words, people that have not had the vaccine are not going to be allowed into some place or on a boat or whatever. I'm just predicting that that's the direction that we're going in, because that would be the safest thing. Once you're on those boats and you're out on the sea, it takes days to get back anywhere, and they've got to be very careful.
All right, here's the next question. My daughter just took a job as a daycare center teacher. The kids are too young for masks. Are kids passing it on to adults frequently?
Actually, they're not. They can pass it on. That's absolutely true. But frequently, it's all relative. Compared to being in the community, kids, especially the smaller kids, pass it on less frequently than when they're in the adult community. So it's a risk because they're working in a situation like that, but it's actually less of a risk than many other situations.
All right, one more question from Lisa. I tested positive for COVID in mid-January, and they say I am no longer contagious. So my question is, when are you available to take me to Paris? Oh my, what? I didn't see that coming.
Wait for the picture. and the W-2s.
The French won't let us in the country.
That sounds like a dodge to the well.
You
I'm
can take
sure-
her to Paris, Texas.
That's right.
We can go to Paris, Illinois.
Paris, Illinois.
sure.
Well, we will pass along your cell phone number to her, so it should not be a problem, Dr.
Yeah.
Murphy. You have a great weekend.
Okay, have a good weekend. Go to Paris, Illinois.
He's unflappable. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again on Monday at this time.